A functional medicine approach to dentistry. Functional dentistry may be the latest weapon in identifying a person's risk for metal toxicities, inflammatory markers, and cardiovascular disease. Functional dentistry is a holistic approach to dental care that emphasizes the prevention of oral disease while aiming to use the least toxic available materials when treating dental issues. The most significant difference between functional dentistry and conventional dentist is their approach to overall oral health. Conventional dentistry focuses on brushing, flossing, mouthwash, and visiting a dentist twice per year for cleanings. Functional dentists examine their patients' eating and lifestyle habits to uncover the root cause of oral microbiome imbalances. Inflamed gum, root canals, crowns, fillings, and retainers can all be culprits affecting your overall health. Although root canals may be a necessary component of functional dentistry, functional dentists are more likely to provide a list of alternative options while teaching you how to properly care for your teeth so that you don't need another root canal in the future. A common issue with metal dental devices and amalgam fillings is heavy metal toxicity. Research has shown that teeth can absorb some of the mercury, nickel, chromium, and iron in stainless steel and silver fillings, dental crowns and permanent metal retainers. Some functional dentists will use specialty labs to test for heavy metals and inflammatory markers in their patients as an add-on service. If your dentist doesn't offer these tests, you can ask a functional practitioner to order them. It's always important to let your provider know of any permanent metal devices or gum inflammation you have so that they can keep track of your symptom and test you annually. So remember, functional dentistry is looking to treat the cause. This would be lifestyle changes and specific tests to identify what's going on. I hope this was useful. Please leave a comment and share a device you have.